Hello, today we're going to go over bacteremia. Bacteremia is just the presence of bacteria in the blood. If it goes untreated, it can lead to infection, which can then lead to sepsis. Bacteria in some parts of the body is normal, and it gets introduced through things like small cuts, toothbrushing, infections we acquire like sinus infections and pneumonia, and so forth. There are some risk factors. These include things like having a procedure done, going into surgery, having IV catheters, Foley catheters, tubes placed. Basically anything that holds microbes and enters the body can cause bacteremia. The most common gram-positive bacteria in bacteremia is Staphylococcus aureus, and it makes up about 42% of cases out of 100,000 U.S. adults in a year. And the most common gram-negative bacteria in bacteremia is E. coli, which makes up about 27% of cases out of 100,000 U.S. adults in a year. So signs and symptoms are pretty similar to those of any infection. You can acquire fever, chills, just a general not feeling well feeling. When symptoms are more severe, like hypotension, tachycardia, change in level of consciousness, damage to other organs, then the infection is likely progressing and you're probably close to going septic if you haven't already. Ways to test for these are blood studies, such as gram stains, labs, and your doctor will want to culture the blood work to know which bacteria is causing the and symptoms and which is the most appropriate way to cure it or treat it. So basically on this list, this diagram here goes over everything in the bullets. The microorganism will enter our body, and it depends on our immune system and our genetic background to fight it off. It'll then enter our blood if it's not able to be cleared initially. And from our blood, it'll go to our liver and our spleen, where it will either eliminate or persist. If it persists, it'll spread to other parts of the body where it will multiply, and then it can cause infection, which could then lead to even septicemia, which is blood poisoning. So we rely on our skin and our mucosal surfaces to prevent bacteria from entering our body. But things that can disrupt this is trauma, burns, and then also things like procedures or surgeries. So bacteremia develops when our immune system has failed to control the spread of the bacteria. This can happen when our body has either acquired defenses or has inherited defenses. And it can also be based off of our body's susceptibility to infection. So treatments are based off of blood cultures. Or your doctor will decide what culture is needed, which broad spectrum antibiotic they should start you on in the meantime, and if this should be administered IV or oral. So this diagram here goes over the guidelines to obtaining blood cultures, because the key to to decreasing the amount of contaminated studies and using the unnecessary antibiotics is by using this chart here. So if you have signs such as severe sepsis, which can come from pneumonia, endocarditis, severe skin burns, basically anything severe that has led to sepsis, and you also have the presence of a fever, then you'll want to obtain 2 sets of blood cultures and test them anaerobically and aerobically. If there's a new infectious process and it's not meeting the above criteria, then blood cultures are not indicated since they have a low yield and the known source should be figured out. If you have a persistent fever and 2 sets of negative blood cultures within 48 hours, plus tachycardic, leukocytosis, hypertensive, or have a fever, it says blood culture likely not recommended or warranted. Following the low-grade fever and leukocytosis, you should consider figuring out the main source and treating that, as well as the contributing factors. So Staphylococcus aureus, it's extremely unlikely to be contaminant, and you always treat it. Coagulated negative Staphylococcus Corynebacterium is usually contaminated, and you usually do not treat. And then Viridians group Streptococcus enterococcus species. They contaminate about half the time, and you should evaluate the possible source, whether it's oral, gastrointestinal, and treat from there. Some disadvantages to treatment is that the delay there that you have to do in order to figure out which bacteria is causing it can result in higher mortality rates and also increased comorbidities or other health problems. Also, the having to use limited antibiotics such as broad spectrum in the meantime are a disadvantage because you have to take more time to figure out which bacteria is causing the infection, and this could just be getting stronger and stronger while we're waiting on cultures. Also, the use of antibiotics always has its impact on other parts of the body, as it can destroy good bacteria as well as bad. And then some advantages are blood cultures allow us to find the specific bacteria and give us better treatment options, and IV therapy is often much quicker and can rid the bacteria faster. So outcomes are usually good if bacteremia is found in a timely manner. There are some cases that lead to sepsis and can cause organ damage and even death. These include endocarditis, osteomyelitis, pneumonia, cellulitis, meningitis, and organ damage. Before vaccines, mortality was greater than 20%, and doctors nowadays are facing even greater concerns because antibiotic resistance is becoming more relevant, and it's a greater concern in today's world. So let me go back. I can't go back anyways. Okay, well, current research today has been, it's pretty cool. So there was a group of researchers at the University of California that did a series of tests. They used over 10,000 proteins and metabolites in more than 200 serum samples, and they tested them for SRS bacteremia. They were able to identify that there was a specific pattern of proteins identified in people that had passed away from SRS than there were that people who had survived. So that's pretty cool, and there's more research being done on that. They were able to prove it with the mouse model, or the moose model, and this finding should be able to lead to faster detection and be able to give more aggressive treatments to people that are at more risk for dying from bacteremia. So there was a case study done on a 15-year-old male patient who had leukemia and had to have a central line placed to start his chemo. A few weeks after having his central line placed, he developed a fever, abdominal pain, and diarrhea. He was treated with antibiotics, and his abdominal pain and diarrhea had subsided, but his fever was still there. So the doctor decided to obtain a blood culture from his central line. On day 1, the blood culture was positive for gram-viable cocci and pairs and chains. On day 2, the growth was small, round, gray colonies were seen on the chocolate agar. There were no catalysts present, and granulocytella addisons was a 2.267 match score was identified. So the doctor determined that the patient most likely got this granulocytella bacteria from his gut, and then it was transferred to immunocompromised area. They treated him with Vanc for his bacteremia, cefepime and metronidazole for his abdominal infections, and then they were going to do further testing to see if it was central line associated. There were only 2 case studies that I could find on this, and both of them were still in the works, so neither of them were complete. But being that he was 15, already going through leukemia and fighting cancer, he is at risk for long-term emotional effects such as anxiety, depression, growth deficits, reproductive issues, learning behavior issues, and even other comorbidities, also developing cancer again. So here's my works cited, and I also did my photo credits. I hope you enjoyed this information, and have a good day.